Well, the Johnson & Johnson vaccine could soon be back on American shelves as the CDC's Advisory Committee on Immunization Practices gets ready to recommend its use on Friday. The shots were put on hold last week following 6 reported cases of a rare and severe type of blood clot. But before deciding if the vaccine rollout could continue, the committee's members said that they needed more information on the vaccine and its possible link to the dangerous blood clot. So joining us now to discuss this and what comes next is pediatric airway surgeon and assistant professor of ENT at Columbia University Medical Center, Dr. Susannah Hills. Thank you so much for joining us, Doctor. Dr. Hills, the European Medicines Agency did not actually find a link between the Johnson & Johnson shot and the blood clots, but they say that the benefits outweigh the risks. I'm not sure if I phrased that properly. They say that the benefit outweighs the risk, so they're willing to resume the vaccine rollout there in Europe. And regulators suggest that vials should really carry a warning label. Like a lot of the medication that we take, there are possible side effects and there are warning labels. What are your thoughts on this, and do you expect similar actions here in the U.S.?
Well, you are absolutely right, Emery. What they said was that the benefits outweigh the risks. So you said it exactly right. And I think that is the way to view the current situation. You know, yes, the complication that we're considering, this clot around the brain, is a really serious one if there is a link. And, you know, we'll wait and see what our regulatory agencies think about the link between the vaccine and these clots. But it's a really important thing for people to be aware of. But the incidence, the numbers of this happening are just so low. It's so unlikely to happen. And it's so likely to get really sick from the coronavirus. And many more people are getting clots from COVID-19, are coming into the hospital sick still due to this virus. So yeah, clearly the benefits are outweighing the risks of this vaccine, I believe. I think we're going to hear the same on Friday. And I hope that we do, because right now, globally, you know, we're seeing a real spike in cases. There were over 5.2 million new cases globally last week. And India's really, you know, sort of one of the countries leading this surge. These countries are going to need more vaccines. India in particular has been experiencing a vaccine shortage, and they're under a lockdown right now. So it's not only for the United States that it's important to get all these vaccines available, but it's really going to be critical on a global scale.
So as you know, Doctor, the American Academy of Pediatrics has found that more than 20% of new COVID cases are in children. As a pediatric surgeon, have you seen an increase of cases in your practice? I note that there are some parents who are concerned because they believe that when they hear statistics like this or when they hear data like this, it's an excuse for municipalities to close down schools again. And they'll say, you know, look, we were told throughout the course of the pandemic that children weren't as susceptible to this as adults, and now you're saying that they are. So what's going on here?
We have seen all along cases in children in New York City, and I work at a children's hospital. You know, every children's hospital in New York City and every children's hospital across the country is seeing cases of COVID-19 and cases of children who are really sick. And yes, we are now seeing that nationally, the numbers and percentage of new cases are really increasing among kids. And it's, you know, probably a combination of factors. One of them being the fact that this new variant strain B.1.1.7 has become sort of the dominant strain here, and children seem to be more susceptible. But, you know, the environment of this pandemic is shifting. It's not been static this entire time. It's been sort of an evolving organism. And we're seeing that now with the increasing numbers of pediatric cases. So I think, you know, with regard to the question about kids getting back to school, I'm a firm believer in the importance of getting kids back to school. I think it's really important for mental health. I think all of the studies that were done last fall in school systems that were open showed that kids who were masking appropriately, who had appropriate social distance, were very safe in the classroom. outbreaks that happened have been linked more to outdoor, after school sports activities like that, not linked to in-classroom activities, not linked to student spread. So I still believe, despite the numbers of increasing cases, that it's safe for kids to be back in school. But boy, the evidence sure shows that masking, social distancing is still incredibly, incredibly important.
Doctor, how much of a factor is the fact that many adults here in the U.S. have at least received one dose of the vaccine, 1 in 3 are fully vaccinated, or have actually already gotten the virus? And so, like water or like electricity, this virus just sort of takes the path of least resistance. And right now, it's our children who are the ones that are perhaps more vulnerable because they're not getting this vaccine.
Yes, so that too. I think that's part of what we're seeing at play here. So a multifactorial situation leading to the fact that we're having more kids getting sick. But the reality is that we're having more kids getting sick, and some of them are getting very sick and ending up in the hospital. And we still don't have approval to get kids under 16 vaccinated yet. Hopefully that will happen in the near future. But that's a major concern. And until we can get herd immunity really well under our grasp here in this country, we've got to continue to take this virus very, very seriously. My other concern is that right now the vaccination program is going really incredibly well, and we're getting around 3 million people a day a dose of vaccine, which is wonderful. And if you thought that was going to keep on continuing at the same pace, you think we might have herd immunity in the next few months, sometime in late summer. But right now we're also sort of thinking that we're likely to hit a wall in our vaccine efforts, and we're going to have to start working to get people who are not seeking vaccination, people who are hesitant, we're going to have to start working to get them vaccinated. It seems that about a third of people who are under the age of 35, and recent polls are saying that they're not planning to get vaccinated. There are 41 million white evangelicals in this country, and 45% of that population is saying they're not planning on getting vaccinated. So although the vaccination rollout has been going really well, I think we're going to be hitting a wall there, and we're going to still continue to see cases if we don't overcome that too.
All right. Dr. Hills, as always, we thank you very much. Appreciate it.
You bet.